Tumor syndromes Part 1. Feel free to pause the video to give yourself time to answer the questions. What 3 organs can be affected in multiple endocrine neoplasia? 1. Pituitary, parathyroid, and pancreas. What gene is affected in multiple endocrine neoplasia? 1. Menin. What are the clinical features associated with multiple endocrine neoplasia? 2. Medullary thyroid carcinoma, C-cell hyperplasia, pheochromocytoma, and parathyroid hyperplasia. A mutation in which gene is associated with medullary thyroid carcinoma? RET. Name 3 genes that have mutations associated with pheochromocytomas. RET, von Hippel-Lindau, and succinate dehydrogenase. What are the clinical features associated with neurofibromatosis type 1? Multiple neurofibromas, optic nerve gliomas, pilocytic astrocytomas, café au lait spots, duodenal gangliocytic paragangliomas, ampullary somatostatinoma, GIST, pheochromocytoma, juvenile xanthogranuloma, and bone cysts. What type of neurofibroma is pathognomonic for neurofibromatosis type 1? Plexiform neurofibroma. What gene is associated with neurofibromatosis type 1? Neurofibromin on chromosome 17. What gene is associated with neurofibromatosis type 2? Merlin on chromosome 22. Aside from bilateral acoustic schwannomas, what else can be seen in neurofibromatosis type 2? Meningiomas and spinal cord ependymomas. Note: café au lait spots can be seen in both neurofibromatosis type 1 and type 2. Clear cell renal cell carcinoma is associated with a deletion of what chromosome, portion of chromosome? Deletion of 3p. The gene VHL is on 3p25. What are the clinical features of von Hippel-Lindau syndrome? Clear cell renal cell carcinoma, pheochromocytomas, cerebellar hemangioblastomas, papillary custadenoma of epididymis, and endolymphatic sac tumor of the ear. Which syndromes can result in the development of Wilms tumor? Waag, Dennis Drash, and Beckwith-Wiedemann. The majority of bilateral Wilms tumors are associated with nephrogenic rests. Chromophobe renal cell carcinoma can be seen in which syndrome? Birt-Hogg-Dube. What are the clinical features of Beckwith-Wiedemann syndrome? This is an overgrowth syndrome and is associated with organomegaly, macroglossia, as well as increased childhood neoplasias, i.e. Wilms tumor, hepatoblastoma, pancreatoblastoma, and neuroblastoma. Which tumors can be seen in tuberous sclerosis? Cardiac rhabdomyomas, angiofibromas, PE comas, and eosinophilic solid and cystic renal cell carcinoma. What are some examples of PE comas? Renal angiomyolipoma, pulmonary lymphangileiomyomatosis, LAM, and clear cell, sugar, tumor of the lung. I hope you enjoyed this video. To get updates when similar videos become available, please consider liking and subscribing.